All about hip dysplasia. Hip dysplasia is a common childhood hip condition affecting 1 to 3% of all infants. Children can be born with it or develop it later on in life. When the hip is healthy, the ball and socket fit together like a lock and key. In infants with hip dysplasia, changes to the shape of the socket or ball, or a change in the position of the ball prevents the joint from fitting together as nicely. In this case, the hip can become loose or out of place. All infants should have an exam performed at birth to test their hip stability to look for hip dysplasia. However, some cases may be missed, such as those which are less severe and those which develop late. The earlier hip dysplasia is detected, the more effective the treatment. So it is important that all babies have their hips tested at each of their well baby visits. Additional testing with ultrasound and x-rays may be required at 6 to 8 weeks if your child has any of the hip dysplasia risk factors shown. It's important to note that because there is a range in the severity of hip dysplasia, every child's treatment journey will look a little bit different. There are many different treatment options available. Some are non-invasive, while others require surgery. Let's look at some of the treatment options. If your child is younger and has less severe hip dysplasia, braces, such as the Pavlik harness or Rhino Cruiser, may be used to hold the hip joint in the proper position as your child's joint matures. If your child has a more severe diagnosis of hip dysplasia, however, surgery may be required to put the ball back into the socket or to reshape the joint. Depending on your child's age and the severity of their hip dysplasia, the number, order, and types of treatments used to treat their condition may differ. We understand that the diagnosis of hip dysplasia may be overwhelming, and that's why we're here for you every step of the way. Remember, early detection is key. No child should suffer the burden of hip dysplasia. For more information on hip dysplasia and your child's hip health, ask your doctor or visit imahippie.org. Find out more at imahippie.org.